Hello, I'm Dr. Varsha Reddy, working as a consultant pediatric neurologist at Yashoda Hospital, Hyderabad. Today, I'll be talking about cerebral palsy as October 6th is observed as World Cerebral Palsy Day. It reminds us that over 17 million people have been affected by this. Cerebral palsy is the most difficult condition that affects our most vulnerable population, children. There is no single cause or an entity to diagnose this disorder, but there are multifactorial. Cerebral palsy is a physical disability that affects movement and posture. Cerebral palsy is an umbrella term that affects a person's ability to move. Cerebral palsy is damage to the developing brain, either before birth or during birth or after birth. Cerebral palsy affects people in different ways. It causes problems in movement, it causes problems in muscle tone, muscle coordination, posture, and body reflexes. Cerebral palsy, although is permanent lifelong condition, the features or the clinical conditions may worsen or improve over time. People with cerebral palsy will also have comorbid conditions like seizures or epilepsy, visual impairment, hearing impairment, intellectual disability. There are some risk factors that cause cerebral palsy. Just because the presence of risk factors does not mean the baby will have cerebral palsy, but there is a high risk of developing cerebral palsy in that child. The common risk factors are prolonged loss of oxygen to the brain during the birthing process, or it could be issues with the placenta. It could be a bacterial or viral infection during pregnancy. It could be due to the baby born preterm or low birth weight. There are different types of cerebral palsy. The most common is spastic type. Next is dyskinetic type. The third one, ataxic type. And the fourth, it could be mixed of the above. Cerebral palsy can be diagnosed clinically when the child presents with delayed developmental milestone, increased muscle tone, and with associated seizures, intellectual disability, or it could be a visual impairment or a hearing impairment. It can be confirmed by neuroimaging like MRI or CT scan. The treatment conditions available for cerebral palsy. First, treat the pain because 3 in 4 children in cerebral palsy have sleep issues and behavioral issues because of the pain. So, next thing is ambulation. So, promote ambulation to the children by a proper orthopedic consultation and to improve the muscle tone by medication. The third one is epilepsy. 1 in 3 children in cerebral palsy will suffer with epilepsy, but about 50 to 60% of them will resolve with medication. Next is a hip displacement, which is most common, and hip surveillance has to be done every year. The kids with cerebral palsy may be non-verbal, so promote the verbal communication in children by speech therapy. With the help of parents, early intervention, and family supporting kids with cerebral palsy, the child with cerebral palsy can lead a most normal contributing life. Thank you.